Hello, everyone. In this presentation, we're going to be talking about joint rejuvenation therapy and how regenerative medicine is changing the future of care for patients who suffer from degenerative arthritis and osteoarthritis in the spine and in the joints. So when we talk about joint rejuvenation therapy, what we're actually talking about is regenerative medicine. And you may or may not have heard of this term before, but what regenerative medicine is it's a branch of medical care that focuses on utilizing therapies and treatment modalities that help the body regenerate or repair damaged or defective cells, tissues, or structure. It's also a non-surgical and also a drug-free approach. And the main point of what regenerative medicine really is that it unlocks the body's self-healing capabilities. 5 or 6 years ago, you might have heard this called stem cell therapy or some sort of stem cell treatment, that type of thing. It's no longer called that. It's usually called regenerative medicine now just because of some rules with the FDA. But when we talk about stem cells and stem cell research, these are things like you might have heard of in the news where scientists can use stem cells to grow new organs, or they can help nerves regenerate, or we can do things like we do in our office here at Vitality Integrative Wellness, and that's to help slow the progression of arthritis for our patients who suffer from joint disease and joint degeneration. So I wanted to take a quick moment and introduce you to our treatment team here at Vitality Integrative Wellness. So we'll go left to right. We have Dr. Matt on the left. He is our chiropractor and does our new patient consultations out of our Hemet office. We have Dr. Jen, who is our chiropractor, and she also does new patient consultations out of our Temecula office. Next, we have Allison. She's our nurse practitioner, and you'll meet with her and consult with her out of both offices. She goes back and forth. And then on the right, this is me, Dr. Bell, and I guess you could call me the founder and CEO. I'm not too big on that title, but this is a creation that I had in 2001, and we've just been expanding and doing great things for patients ever since, and I love what we do. And we have a fantastic team here at Vitality Integrative Wellness. The number one thing that I would say to any person that I met on the street, or if somebody asked me what I do, and they were suffering from some sort of back problem or joint problem, is that we can help you. And that's something that patients these days don't always feel like medicine has their best interest at heart, or maybe it's failed them, maybe it's not working. But I just wanted to tell you a little bit about our background. And we started as a chiropractic clinic in 2001, and so I opened our first office in Old Town Temecula, and then we progressed to a clinic in Hemet around 2005. So we've had those two locations, and we're looking to add more down the road. But what we did in 2014 is we medically integrated, which means we blended our chiropractic practice with a medical practice, so to speak. And so we brought medical services into our clinic, because what I started to realize is that there's so much good that happens in medicine, but it never gets utilized because it's overshadowed by pharmaceutical drugs, and it's overshadowed by sometimes even bias against natural healing methods or natural health care. And then, of course, there's a large push with the joints to have surgery as well. And so what I recognized is there's a large number of patients that actually don't want those things, but they don't know where to go. And so we brought all of that together, and that's why we call it Vitality Integrative Wellness. We are one of the only true integrative medical facilities. There are others, of course. It's not that we're the only one, but what makes us unique at Vitality is that we do what's called team treatment. And by that, I mean that in a lot of integrative clinics, there's a bunch of doctors, sometimes 10 or 15 even, and they all rent a little room. And so it's integrated, but you have to book separate appointments with the other doctors. But at least with our group, we are a little bit more narrowly focused with, back pain, joint pain, functional medicine, some other things. And what we do is you will see sometimes our nurse practitioner along with our chiropractor and our massage therapist, and that can all be done in the same visit. And that's the nice thing, is it cuts the time down. You don't have to visit multiple doctors. And typically we can get done in a 30 to 60-minute appointment, which might take you 2 to 3 hours in another doctor's office. The other nice thing is that because regenerative medicine has so much research behind it, it's very safe. It also has a high amount of successful patient outcome as well, which is very, very good, because it does allow us to do some things for you that other more traditional Western healthcare practices may not necessarily be able to do. So a common misconception, or at least maybe a patient assumption, is that they're coming into our clinic for pain because of the amount of inflammation and damage that can be happening in joints. So of course, we recognize that pain is part of the issue, but pain is not the problem. But what I want you to imagine is if you could walk your dog again, if you could exercise without pain, if you could get up out of a chair without help, or get a good night's sleep because you're not hurting. Maybe you're tired of the side effects of drugs and you want to eliminate some of those from your life, or even just laugh at a joke because life isn't so serious. And so my point here is that when you come to our office, what you're seeing or what you're experiencing is an opportunity to get your life back. We don't just look at ourselves as just getting you out of pain. That can be done by many different ways. But what we want to do is we have a bigger vision for you, and that's that time is the only thing that you can't get back in life, and it's the one thing you cannot buy. It's something you can't commoditize. And so if we can shorten that time that you are allowed to get your life back, or that you can start living your life again, then we look at that as our main purpose in treating you as a patient. So I know I mentioned that we can't use the words stem cell therapy, but I do feel it's important to understand what stem cells do in our body. And so I'll just teach you some of the basics. It's not like we're trying to make you a scientist or anything like that, but it is important to understand how your body heals and why stem cells are so important in that healing. And one of the things we have to remember is that we need to take care of the cells in our body. We have to take care of our bodies. We only get one. And so our stem cells age as we get older, so do our stem cells. If we are healthy or unhealthy, then stem cells tend to follow that similar pattern as well. So stem cells can be affected by your environment, either positively or negatively. So things like stress and smoking, drinking, medications that you take, diseases that you suffer from or have had can all affect the quality of your stem cells, how fast your stem cells regenerate themselves or turn over, and where they need to be utilized in the body. So we do tend to have a limited supply. At least that's what the research has shown, is that as we get older, the number of stem cells that we have in our body is decreasing, and that also stem cells tend to age. And so just like as we get older, it sometimes feels like we're slowing down, or we can't move as fast, or we don't recover from sickness and disease. And they're finding that stem cells also are aging, so they slow down. They don't turn over as fast. And that's why it's a little harder to heal once you hit about 50 years of age. So stem cells are cells inside of our body that provides new cells throughout our lifetime. So the natural healing cell in the body is a stem cell, and a stem cell can develop into all other cells. So stem cells can become cartilage, ligament, bone, brain cells, blood cells. They can even have the ability to regenerate cells in your heart, your liver, your pancreas, and your lung. So anytime your body needs a regenerative process, even as simple as like a cut on your skin, that's going to happen because of stem cells. And so the thing to think about stem cells is stem cells give us life. One thing that we know about chronic disease, and arthritis would qualify as a chronic disease, is that in the last 25 years of using alternative medicine and Western medicine, there really has been no real good process to help arthritis sufferers. But this is the first time, since 2014, we've been doing this now about 8 years or so, where we can actually say that arthritic degeneration can be stopped, it can be slowed, and in some cases even be reversed. And so the future for arthritis sufferers is very promising. Now, again, chronic disease management in a traditional Western healthcare setting is going to involve largely drugs, steroidal treatments, physical therapy, and then eventually probably surgery if it gets to that point. So there really wasn't any hope except for patients to follow that track. And so that would allow arthritis to degenerate and cause joint destruction. But regenerative medicine's been around about 25 years. It really gained popularity about 10 years ago. And so this is what's paved the way to slow the damage and help patients find pain relief. Regenerative medicine is very widely researched. Most of the major universities in the United States and around the world have a department of regenerative medicine or a department of regenerative studies. And that's where scientists and researchers spend their time learning about how stem cells function, learning how they work in our bodies and what type of signaling do they do. And that's what they're finding lately, is that stem cells are really signaling cells that initiate a healing response through your immune system. So again, this is a great time to have an issue, or really don't mean that we're glad that you haven't had pain or that you're in pain, but if you are going to have arthritis and get it, this is probably one of the best times that I've seen in the last 25 years where patients actually have the ability to overcome a chronic disease like arthritis. One of the most interesting things that I've always found to be quite astonishing is how many patients come into our office for a consultation and they've never seen their x-rays, or the doctor ordered x-rays and never called them to tell them there was something wrong, and there was clearly something wrong when they brought them into us. And that's not all doctors, of course, but many patients have never even seen what arthritis looks like. They're just told. And so we, as a clinic, love to educate our patients. We believe that patients are part of the process here, and so it's a very collaborative environment. But if you look at a knee, you can see here on the left that this is a normal knee, and the knee looks very straight. The joint is very clear, and it looks to be well aligned. And if you look at the joint on the right where it says arthritic knee, you can see that the cartilage is clearly thinner than it should be. It's uneven. You could maybe see that the knee looks like it's almost out of alignment, or looks like it's almost ready to slide off to the left there. You can see bone spurs, you can see calcifications in some of the ligaments and some of the muscles. And so this is definitely something that's very common that we see in our office when patients suffer from a knee problem. So we have a hip here, and hips are somewhat challenging even in regenerative medicine. And my personal opinion is that it's allowed to continue for such a long time with medical treatments. It's a very strong joint, and so it can take a lot of abuse before it actually has to be surgically operated on. If I could give any advice to a patient suffering from a hip problem, is that it's to treat it early. And the reason that is because once the joint becomes bone on bone, which is what you can see on the right, then this is something where no amount of regenerative medicine, no amount of rehabilitation is going to fix something that's completely wore out. So you have to leave some soft tissue in there. You have to leave some fluid in the joint. There has to be something to work with, essentially. And so with hips, it is something where if we do have to turn away a case, or it's something where we cannot take the case, it's usually going to be a hip. So doesn't mean to count yourself out that we can't help you. It's just we will be very careful because we need to make sure that it's going to be successful for you. And in doing so, we have to have enough tissue left that we can actually affect a change in the hip joint. Another very common condition that we see are shoulder problems. And the shoulder is a unique joint because it's largely attached by mainly soft tissue, so muscles, ligaments, cartilage, etc. The joint isn't a typical ball and socket joint or an articular joint. The shoulder joint is also the most mobile joint in the body, so it can be very susceptible to damage. And when it does get damaged, it can be very painful. We, of course, as human beings, use our arms and hands for almost all activities, and so if we lose the ability to use our shoulder, it's also, a very debilitating situation. So some common things you might have heard of are rotator cuff injuries, labrum tears, uh, cartilage and joint degeneration in the AC joint, or it's called the glenohumeral joint. The shoulder also has the nerves from the neck that run down through the shoulder joint, and so shoulder problems can also cause things like numbness and tingling in the hands, loss of grip strength, the feeling that you have carpal tunnel. And shoulders fortunately respond very well to regenerative medicine because with the soft tissue that is involved with the shoulder, that's one of the best things that regenerative medicine has available treatments and therapies for. We have a whole separate presentation on the spine and some of the things that we can do for the spine, but we do have a regenerative medicine program if you were suffering from degenerative disc disease, bulging discs, spinal stenosis, or it's the term that you might have heard called pinched nerves. It's kind of a layman's term, but that's a lot of times what doctors will explain it as. But essentially, there's some sort of cartilage or joint destruction going on, and that's putting pressure on the nerves. So if it's in the lower back, you may have heard of sciatica before. You might have also heard of peripheral neuropathy. That's another one that's very common when we get low back pain. And I don't have a neck x-ray here, but the same thing would apply if you have neck pain or you have like damage from whiplash or a car accident, or maybe you played football or sports when you were younger and your neck curve is not going in the right direction. We, again, do very, very well with that. You can imagine with our background being in chiropractic care, this is one of our areas of expertise, and I feel we do a really good job with low back and neck pain. So you've heard me mention this briefly already, but traditional Western treatments often fail when it comes to chronic disease. And again, this isn't a bash on traditional Western medicine. We're not anti-Western medicine, but when we see the same things happening over and over again, where patients just keep getting more and more pain pills, more and more drugs, more and more cortisone shots, and they're not getting better, then, it might be time to look at a different alternative. And so we want to just get our point across that medication can be very good, especially in an emergency situation or something that's short term. Pain medication sometimes can be helpful. So I would say, 1 month to maybe 3 months max. If pharmaceutical drugs aren't helping you, there's probably something else going on in there. Maybe it's time to look for an alternative. But if you look at the history of pain medications and anti-inflammatories, or you look up the intended use of the drug, many times you'll see that these drugs are only intended for short-term use, 4 to 6 weeks. But we find patients that are chronically being left on these medications, sometimes 2, 3, 4 years. So that's definitely something where you can have issues with liver problems, kidney problems. It can cause all kinds of different side effects when these medications are taken long term. So it's definitely something that we feel patients should be informed of, and a lot of times they're not. Cortisone shots are very similar. It's one of the more popular injections, I would say, for joints. And so cortisone is an injection of a very powerful anti-inflammatory given through a needle and a syringe directly into the joint. Some of the side effects of cortisone can be that it'll slow the repair of collagen, and it's usually only a temporary fix, even though it may get you out of pain quickly. Usually we find the first one works quite well, and then the following two, they're given in a cortisone shots are given in a series of 3. The following 2 don't work that well, and so a lot of times that's frustrating for the patient because they feel like, well, it didn't work, or but there was no education given as to what's going on with the intention of cortisone, and it is only considered a temporary fix. It is not a permanent solution for arthritis. So when we think about stem cells and we think about what stem cells do, stem cells are natural anti-inflammatory cells, or they are the anti-inflammatory cells within our body. So it may sound a little counterproductive, but it's important that the body is allowed to go through its inflammatory process, because those inflammatory cells are what signal stem cells. Remember, we talked about stem cells potentially being signaling cells. So if you think of inflammation like the fire alarm going off, then the stem cells would be the fire department heading to that area to repair the damage. So there's been drugs invented called anti-inflammatories. NSAIDs, or non-steroidal anti-inflammatory drugs. Cortisone is a steroid. It's an anti-inflammatory. So if you can imagine that these drugs block that inflammation, then effectively cortisone are going to block the signaling of stem cells. So this can affect the ability of stem cells to heal damaged joints. There's research that's shown that cortisone shots actually allow arthritis to progress faster versus somebody who never got a cortisone shot. And so all this information is out there. And the common misconception is that inflammation is bad, and then we need to take anti-inflammatories to block the inflammation. And when in fact the opposite is true. If we allow the body's stem cells to do the healing, then we would see much better results. And in fact, that's what we see with our patients when they decide to go under a regenerative medicine program. They're healing within weeks, sometimes even days, but generally it takes a few weeks to a couple of months. But the 2 to 3 years of suffering can go away very quickly within just a matter of a short amount of time. Since stem cells are the healing cells of your body, then one of the main goals that we have for our patients when they need regenerative medicine is that we need to turn on that power of healing. And the other thing that we also do that's unique in terms of just the philosophy of seeing patients and helping patients is that instead of treating the symptoms, which would be pain or inflammation, we want to look at what the underlying cause of that is, or get to the root of the problem, if you've ever heard that term before. So we use diagnostic testing to uncover the cause of why your health has declined. Our care programs are also customized per patient. So it's not a one-size-fits-all treatment, and each person has a little different, unique set of characteristics or a unique set of problems, and so we want to make sure that we pay attention to that. And again, that is also, like I said, what makes us unique. So a program, if you were wondering what that would look like, it's generally going to involve a combination of umbilical cord vesicles, possibly PRP, which is platelet-rich plasma. We also will incorporate chiropractic care, laser therapy, ozone therapy under a process called prolozone. And we can also use non-surgical spinal decompression, which is a machine that we have in the offices that will help patients who have neck and low back disc degeneration. Long term, the best way to prevent this from happening is to develop new habits of nutrition and exercise that allows your body to maximize the healing and to keep the inflammation levels low. And so this is how we approach this type of program with our patients. And if you talk to some of the patients in the office or look at some of our testimonials on our website or online, you can see that most patients do report a very positive outcome. Like I said earlier, we use an integrated approach. So we're never going to just do an injection and send you away. And we've had patients show up to our office that have had that happen, and they don't seem to get as good a results as they do when we put them under a combination of therapies. And so that's our program, as it's centered around rehabilitation and improvement in function. In order to do that, it takes a couple of different things that need to happen. We have to reduce inflammation. We have to stimulate the body in a way that will get the healing process moving. And once things start to improve, then we have to come in and realign the joint. Sometimes the chiropractic care, there's exercises that we do, and sometimes we might even have to do trigger point therapy with massage, or sometimes we may have to do some other types of injections like we talked about. So again, it's not a one size fits all treatment, and that's what our consultation process is for, is to figure that out. But an average program is going to last around 1.5 to 3 months. Easily one of the most successful things we've added to our practice in the last 10 years has been joint rejuvenation therapy and the technology behind regenerative medicine. So if you're looking for an alternative to surgery, or if you're tired of taking medications that are no longer working, or you are being told you have early onset arthritis, or maybe you have achy joints and you just don't know why your joints are achy, then there's certainly a reason there that I would think for you to give us a call, talk to us, and see what we can offer you as a natural, non-surgical, non-drug alternative. So our new patient coordinators are standing by to take your phone call, and we would love to consult with you, have you come into our office and meet us, and have that consultation. It does last around an hour or so. It's very thorough, and you'll hopefully learn some information, learn some new stuff that you can do to take a little bit more proactive approach to your health. Also, it invites spouses, friends, family members that you might know that have the same problems or similar problems to give us a call as well. If you'd like more information, we're on the web at www.growwithvitality.com, and we're also on Facebook and Instagram, and our handle is at Vitality Integrative Wellness. Thank you for listening to our presentation today on joint rejuvenation therapy, and we look forward to seeing you in the office very soon.